Glutathione is an antioxidant and it's produced in the cells. It's comprised largely of 3 amino acids, glutamine, glycine and cysteine. Glutathione levels in the body can be reduced by a number of factors, including poor nutrition, environmental toxins and stress. Its level also declines with age. In addition to being produced naturally by the body, glutathione can be given intravenously, topically or as an inhalant. It's also available as an oral supplement in capsule and liquid form. At first glance, glutathione is similar to other well-known antioxidants like vitamin C and vitamin E. What's remarkable is that unlike most of the antioxidants, think resveratrol and quercetin, your body can make its own glutathione. It just needs the right building blocks. In fact, your body needs to make glutathione in order for you to live a healthy life. Scientists have even suggested that its levels are a great predictor of your lifespan. Selenium is required by your body to make the glutathione. This should be dosed at 200 micrograms per day, or 3 Brazil nuts. A selenium deficiency can happen in many ways. For example, it's found to be low in people who are suffering from heavy metal poisoning such as mercury, amalgam, dental fillings. Glutathione reduces oxidative stress. Oxidative stress occurs when there's an imbalance between the production of free radicals and the body's ability to fight them off. Too high a level of oxidative stress can be a precursor to multiple diseases. These can include diabetes, cancer, and rheumatoid arthritis. Glutathione helps to stave off the impact of the oxidative stress, which may, in turn, reduce the disease. An article cited in Journal of Cancer Science and Therapy indicated that glutathione deficiency leads to increased levels of oxidative stress, and this might lead to cancer. It also stated that elevated glutathione levels raised the antioxidant levels and the resistance to the oxidative stress in cancer cells. You can see my other video on inflammation, antioxidants, and on autoimmune disease for more information on natural ways to reduce the damaging effects of the oxidative stress. With less glutathione, free radicals can harm the body and accelerate the aging process and cognitive decline. Multiple studies have uncovered that the body makes less of this antioxidant as it ages. In women, its levels drop at the beginning of the menopause and they remain lower thereafter. Increasing oxidative stress from low levels in older people can make the bones more fragile and can contribute to osteoporosis. Cells depleted of glutathione are susceptible to damage. Low levels trigger a cascade that ultimately leads to cell injury and death, and this accelerates aging. Research has uncovered that people with depression have low glutathione levels. Accordingly, glutathione prevented depression in animals who were under stress. And what's more, anti-anxiety drugs may work in part by raising glutathione levels. People with schizophrenia have low glutathione levels. N-acetylcysteine, which increases glutathione levels in the brain, improved the symptoms of schizophrenia in clinical trials. People with obsessive-compulsive disorder may have low glutathione levels in certain parts of their brain, and high blood levels of free radicals. Boosting the glutathione can improve the antioxidant defense, the stress resilience, and the overall symptom severity. Since multiple drugs used to treat bipolar disorder work by increasing glutathione levels, naturally boosting it may also help to stabilize mood and your symptoms. A small study indicated that whey protein, when given orally, improves psoriasis with or without additional treatment. Whey protein had been previously demonstrated to increase glutathione levels. Study participants were given 20 grams as an oral supplement daily for 3 months. This is understandable as psoriasis is considered to be an autoimmune condition related to over-inflammation due to a lack of sufficient antioxidants to neutralize the damaging free radicals. Cell death in the liver may be exacerbated by a deficiency in antioxidants, including glutathione. This can lead to fatty liver disease in both those who misuse alcohol and those who don't. Glutathione has been shown to improve protein, enzyme, and bilirubin levels in the blood of the individuals with alcoholic and non-alcoholic chronic fatty liver disease. A study reported that glutathione was most effective when given to people with fatty liver disease intravenously in high doses. Participants in the study also showed reductions in melandialdehyde, which is a marker of cell damage in the liver. Another small study found that orally administered glutathione had positive effects on people with non-alcoholic fatty liver disease, following proactive lifestyle changes. In the study, glutathione was provided in supplement form in a dose of 300 mg per day for 4 months. Many swear on the ability of liposomal glutathione spray to reduce hangovers and even increase alcohol tolerance. The reduction in glutathione with age may be a factor for hangovers also getting worse with age. As people age, they produce less glutathione. Researchers at Baylor School of Medicine used a combination of animal and human studies to explore the role of glutathione in weight management and insulin resistance in older individuals. Study findings indicated that low glutathione levels were associated with less fat burning and higher rates of fat storage in the body. Older subjects had cysteine and glycine added to their diets to increase the glutathione levels, which spiked within 2 weeks, improving the insulin resistance and the fat burning. Peripheral artery disease occurs when the peripheral arteries become clogged with plaque. It most commonly happens in the legs. One study reported that glutathione improved the circulation. It increases the ability of the study participants to walk pain-free for longer distances. Participants received glutathione rather than a saline solution placebo, and they were given intravenous infusions 2 times daily for 5 days, and then analysed for mobility. The enzyme serrapeptase has also been shown to be beneficial for this condition. Parkinson's disease affects the central nervous system and is defined by symptoms such as tremors. It currently has no cure. One older study documented intravenous glutathione's positive effects on the symptoms such as the tremors and the rigidity. While more research is needed, this case report suggests that glutathione may help to reduce the symptoms, improving the quality of life in people with this disease. You can check out my video on Parkinson's disease for more information about natural ways to help to treat this condition. The chronic inflammation caused by autoimmune diseases can increase oxidative stress. These diseases include rheumatoid arthritis, celiac disease, and lupus. According to one study, glutathione helps to reduce oxidative stress by either stimulating or reducing the body's immunological response. Autoimmune disease attacks the mitochondria in specific cells. Glutathione works to protect the cell mitochondria by eliminating the free radicals. Glutathione's antioxidant capacity can be increased when it's taken with vitamin C at a dose of at least 500 mg per day and alpha-lipoic acid at 600 mg taken 2 to 3 times per day. Several studies, including a clinical trial reported in Medical Science Monitor, indicate that children with autism have higher levels of oxidative damage and lower levels of glutathione in their brain. This increases the susceptibility to neurological damage in children with autism from substances such as mercury. You can check out my other video on mercury amalgam dental fillings to learn about natural supplements to help to detoxify the body from heavy metals. The 8-week clinical trial on children aged 3 to 13 used oral or transdermal application of glutathione. Autistic symptom changes were not evaluated as part of the study, but the children in both groups showed improvements in cysteine, plasma sulfate, and whole blood glutathione levels. Long-term high blood sugar is associated with reduced amounts of glutathione. This can lead to oxidative stress and tissue damage. A study found that dietary supplementation with cysteine and glycine boosted glutathione levels. It also lowered oxidative stress and damage in people with uncontrolled diabetes, despite the high sugar levels. Study participants were placed on a 0.81 millimole per kilogram of cysteine and a 1.3 millimole per kilogram glycine daily for 2 weeks. You could check out my video on type 1 and type 2 diabetes for more natural solutions on blood sugar control. Glutathione blocks the production of most inflammatory cytokines. If you suffer from chronic health issues, cytokines can help you in a state of constant low-grade inflammation. Glutathione deficiency caused inflammation in mice. Blocking inflammatory pathways restored its levels. This suggests that glutathione and inflammation are in a very tight mutual relationship. On the other hand, glutathione blocks NF-kappa B, the master controller of inflammation in the body. This protein complex increases the activity of various inflammatory genes and their products. A number of airway and lung diseases are caused by excessive inflammation, and they can benefit from restoring healthy glutathione levels. Low activity of glutathione peroxidase and low levels of glutathione are linked with high oxidative stress and an increased likelihood of heart attack. Cardiovascular disease is largely caused by oxidative stress in heart tissues. Glutathione can reduce free radicals and in turn it may prevent stroke or heart attack. Various drugs of abuse like cocaine and methamphetamine, as well as alcohol, increase the production of reactive oxygen species. These in turn can alter the brain and behavior or cause damage. Some studies suggest that increasing the glutathione can help to overcome addictive behaviors, which span from eating disorders to alcohol and drug abuse. Increasing the antioxidant defense not only protects the brain, but it also helps to detoxify harmful substances from the body. Chronic alcohol abuse reduces the glutathione in the liver. Raising the glutathione levels improved liver function during the abstinence. Alcohol abuse also increases oxidative stress in the lungs, which can often lead to infections such as pneumonia. Glutathione may be able to protect the lungs by reducing the oxidative stress. Glaucoma and cataracts can gradually lead to blindness. Since oxidative stress underlies both conditions, boosting glutathione may protect the eyes. Clinical studies would need to look into this benefit though. Low glutathione levels may predispose pregnant women to depression and impair fetal brain development. Increased oxidative stress in the fetus has been linked to preterm labor. Boosting glutathione and antioxidants through sulfur and cysteine-rich foods can help to maintain a healthy pregnancy. People with cystic fibrosis have low glutathione levels and high oxidative stress. Low glutathione levels in the lungs impairs breathing and it triggers airway damage. Glutathione inhalation may improve the symptoms of cystic fibrosis. Oxidative stress in the kidneys can cause mild kidney problems or even full-blown kidney failure, depending on its severity. In a study of 20 people with chronic kidney disease on hemodialysis, glutathione improved the kidney function and reversed the anemia. In rats, the glutathione booster N-acetylcysteine prevented the kidney disease from the artificial sweetener aspartame. People with irritable bowel disease have decreased activity of the enzyme involved in glutathione synthesis. They also tend to have lower levels of its main ingredient, cysteine. The most important enzyme involved in quenching free radicals is called glutathione peroxidase. This enzyme uses glutathione and it requires selenium to work with the harmful substances. High levels of this enzyme point to more oxidative stress that needs to be neutralized. This enzyme also helps to renew and strengthen the gut lining. In animals, glutathione protected the gut lining, which may help to prevent a leaky gut. N-acetylcysteine is a medication used to treat conditions like asthma and cystic fibrosis. As an inhalant, it helps to thin the mucus and make it less paste-like. It also reduces inflammation. N-acetylcysteine is a byproduct of glutathione. My video on asthma and my video on hypoxia have more information on natural ways to help you breathe. Glutathione is found in some foods, although cooking and pasteurization diminishes its levels significantly. Its highest concentrations are in raw or very rare meat, unpasteurized milk and other unpasteurized products, freshly picked fruits and vegetables like avocado and asparagus. Viral infections flood the body with oxidative stress due to inflammation, using up more glutathione. In many chronic diseases, poor immunity and an increased rate of infection are linked to low glutathione levels. Once glutathione is depleted, immune cells lose their ability to fight infections. N-acetylcysteine, which boosts the glutathione in the body, restored the ability of the immune cells to kill the bacteria that causes tuberculosis. In another study, maintaining the cysteine levels helped to keep glutathione in check. In turn, immune cells regained the power to destroy the microbes. Older AIDS patients produce less glutathione, which weakens their already fragile immune systems and decreases the insulin sensitivity. Increasing glutathione levels may help to improve and reduce the incidence of bacterial infections. Reactive oxygen species are continuously generated while the brain burns fuel for energy. The brain needs to detoxify them to stay healthy, and glutathione plays a key role in making this possible. Alzheimer's disease is, in part, caused by oxidative stress. Antioxidants may prevent or slow the disease. Several clinical studies have shown that oral vitamin E, a powerful antioxidant, slowed the progression of Alzheimer's. The buildup of toxic proteins in Alzheimer's further lowers glutathione levels, making the patient more likely to be deficient. In mice with Alzheimer's, increasing glutathione could boost memory, reduce plaque buildup, and improve the overall symptoms. Glutathione contains sulfur molecules, which may be why food that's high in sulfur helps to boost its natural production in the body. These foods include cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, and bok choy. Alum vegetables like garlic and onions. Eggs, nuts, legumes, lean protein like fish and chicken. The supplements DL-methionine and MSM are also sulfurous supplements that can help with methylation. Other foods and herbs that can help to naturally boost glutathione levels are milk thistle, flaxseed, guaso seaweed, and whey. Glutathione is also negatively affected by insomnia. Getting enough rest on a regular basis can help to increase levels. You can see my video on herbs to help you sleep and my video on melatonin for more information about this. Glutathione is a powerful antioxidant that's made in the body's cells. Its levels decrease as a result of aging, stress, and toxin exposure. Boosting glutathione levels may provide many health benefits, including a reduction of oxidative stress. The most effective form appears to be S-acetylglutathione, where it was shown that 200 mg per day is equivalent to a 1000 mg intravenous glutathione dose. Or to put it another way, $40 of S-acetylglutathione capsules is equal to around $4,000 of IV glutathione. Also be sure to take N-acetylcysteine at 500 mg 3 times per day, as this is a precursor, and have selenium at 200 micrograms per day to supply your body with the necessary ingredients to produce the glutathione. If you take 500 mg of vitamin C and 600 mg of alpha-lipoic acid 2 to 3 times per day, this can also enhance the effect of glutathione. Glutathione can be hard for some people who have an MTHFR polymorphism positive status. Therefore, check out my video on the MTHFR polymorphism and the supplements that can be used to help to treat this condition naturally. For more information about the herbs or supplements mentioned in this presentation, check out my website.